female and female and male reproductive organs. Testes are the male reproductive gonads and ovaries in females mostly seen. Okay, these reproductive organs are responsible for sexual reproduction since they are responsible for the production of male and female gametes. Okay, these both are responsible for the production of male and female gametes. Gonads are responsible for producing sex hormones. These are the gonads that are responsible for producing sex hormones. Okay. Mm, Required for the development and growth of primary and secondary sexual characteristics. Okay, these are required. These gonads are required for primary and secondary sexual for the development and growth of primary and secondary sexual characteristics. Okay, see here mm, these are the gonads in different stages. We have seen in different stages. Okay, these are the gonads. These gonads are present in both male and female to produce male and female gametes. Okay, and this is the mesonephrons, and this is the Mullerian duct. Mullerian duct, also known as paramesonephric ducts. Okay, these are paired ducts of the embryo that run down the lateral sides of urinogenital ridge and terminate at the sinus tubercle in primitive urogenital sinus. Okay, in the female they develop to form the fallopian tubes. Okay, they develop to form the fallopian tubes and uterus. Okay, uterus, cervix, cervix is present upon. Okay, and the upper one third of the vagina. Okay. Mm, this is the main function of Mullerian duct. Okay, paramesonephric ducts. Okay, Wolffian duct. Here, this is the Wolffian duct. Wolffian duct function is it is also known as mesonephric duct. It is one of the paired embryogenic tubules. It is one of the paired embryogenic tubules. Okay, that drain the primitive kidney mesonephrons to cloaca. It also gives off a lateral branches forming the uteric bud. It forms a uteric bud. In both the male and the female, the Wolffian duct develops into trigone of the urinary bladder. Okay, this develops into urinary bladder. Okay, now let's discuss about the overview of this both reproductive systems. See here, this is the fallopian tube and this is the ovary. Okay, the, and in female, okay, this is the uterus and this is the vagina. Whereas in males, this is the seminal vesicle and it is the prostate gland. Mm, and this is the vas difference and it is the epididymis and these are the testes. Okay, this is the overview of male and female reproductive systems. Okay, now let's continue the class. Gonads, sex hormones. Okay, being a component of endocrine system, both male and female gonads generate sex hormones. These both male and female gonads generate sex hormones. The sex hormones are steroid hormones. ఈ సెక్స్ హార్మోన్స్ అనేవి స్టెరాయిడ్ హార్మోన్స్ అన్నమాట and can pass through the cell membrane of the target cells. These can pass through the cell membrane of the target cells. Gonadal hormones are regulated by hormones secreted by the pituitary gland in the brain. Okay, these hormones are regulated by the hormones which are secreted by the pituitary gland in the brain. Okay, as earlier I discussed and I showed the diagram in diagrammatic representation, the pituitary gland in the brain, these gonads, okay, which are which are transported from the enzyme which is transported from pituitary glands. Okay, hormones that are responsible for stimulating the gonads to produce sex hormones are called gonadotropins. Hormones which are responsible for stimulating. Okay, stimulating and producing, stimulates the gonads and produces sex hormones. దాన్నే gonadotropins అంటాం అన్నమాట. Gonadotropins ని luteinizing hormone and follicle stimulating hormone అన్నమాట. These are secreted by anterior pituitary gland. Means in pituitary gland. Okay. Now let's discuss about this. Okay. The pituitary hormones influence reproductive organs in many ways. Pituitary hormones influence reproductive organs in many ways. Okay. Testes are stimulated by luteinizing hormone to secrete sex hormone testosterone. Testes అనేవి secreted by luteinizing hormone for what purpose? Means to secrete the sex hormone testosterone, and ovaries secretes estrogen and progesterone. Ovaries secretes estrogens and progesterone. The follicle stimulating hormone is involved in the maturation of ovarian follicles. Follicle stimulating hormone యొక్క function ఏంటంటే it is used for the maturation of ovarian follicles. Okay. Okay, the testes are stimulated by the luteinizing hormone. Okay, for what purpose? Means to secrete the sex hormones testosterone, whereas ovaries secretes estrogens and progesterone. Okay, follicle stimulating hormone is involved in the maturation of ovarian follicles. Okay, sac we have ovarian follicles means that sacs that contain ova. Okay, in females, and production of sperms in males. Okay, the follicle stimulating hormone ఏం చేస్తుందంటే involved in maturation of ovarian follicles in females and production of sperms in males. Okay, now let us discuss about female gonad hormones. Okay, major hormones of the ovaries are progesterone. Okay, female gonad hormones. Okay, the major hormones of ovaries are, as earlier we discussed, progesterone and estrogens. Okay, we all know about these. Okay, estrogens, it is a group of female sex hormones. Okay, it is a group of female sex hormones essential for both reproduction and development of female reproductive system. Okay, estrogens are responsible for maturation and growth of vagina and uterus, widening of pelvis, breast and uterus changes during the menstrual cycle, and increasing growth of hairs on the body. Okay, ఈస్ట్రోజన్ ఏం చేస్తుందంటే మెచ్యురేషన్ అండ్ గ్రోత్ ఆఫ్ వెజైనా. ఓకే, గ్రోత్ వెజైనా యొక్క గ్రోత్ మెచ్యురేషన్ కి ఉపయోగపడుతుంది. యూట్రస్ గ్రోత్ మెచ్యురేషన్ కి, పెల్విస్ వైడ్ అవుతుంది. బ్రెస్ట్ అండ్ యూట్రస్ కూడా వైడ్ అవుతుంది. యూట్రస్ లో చేంజెస్ కనిపిస్తాయి. ఎప్పుడు అంటే డ్యూరింగ్ మెన్స్ట్రువల్ సైకిల్లో. అప్పుడు ఏమవుతుందంటే హెయిర్ గ్రోత్ అనేది కనిపిస్తుంది బాడీలో అన్నమాట. Okay, now let us discuss about progesterone. These are hormones whose function is to prepare the uterus for conception. ఈ హార్మోన్స్ ఏం చేస్తాయి అంటే యూట్రస్ ని కన్సెప్షన్ కి రెడీ చేస్తాయి. ఇది ఏం చేస్తుందంటే regulating changes in the uterus during menstrual cycle, ovulation, aids, and stimulating gland development for the production of milk during pregnancy. Okay, now let us discuss about male gonad hormones. Androgens are hormones that majorly influence the development of male reproductive system. Okay, androgens అనేవి major hormones major role play చేస్తాయి. Okay, for what purpose? Means development of male reproductive system. Okay, testosterone. Testosterone is responsible and essential for increased growth of bone and muscle, growth of body hair, developing broader shoulder, voice deepening, and growth of the penis. Okay, ఈ మేల్స్ లో టెస్టోస్టిరాన్ హార్మోన్ ఏం చేస్తుందంటే వాళ్ళ యొక్క బోన్ మజిల్ గ్రోత్ కి, బాడీ హెయిర్ గ్రోత్ కి, షోల్డర్స్ బ్రాడ్ గా డెవలప్ అవడానికి, వాయిస్ అనేది డీపెనింగ్ అవ్వడానికి, ఓకే, అండ్ పెనిస్ యొక్క గ్రోత్ కి ఈ టెస్టోస్టిరాన్ హార్మోన్ అనేది యూజ్ అవుతుంది అనమాట. ఆండ్రోస్టెనిడాన్ అంటే దీస్ ఆర్ ద హార్మోన్స్ that act as a precursors to estrogen and testosterone. Okay, this androstenedione అనే హార్మోన్ ఏం చేస్తుందంటే acts as a precursor to estrogen and testosterone. Okay, inhibin ఏం చేస్తుందంటే these hormones inhibit the release of follicle stimulating hormone and thought to be involved in sperm cell regulation and development. Okay, inhibin అనే హార్మోన్ ఏం చేస్తుందంటే inhibits the release of follicle stimulating hormone in males. Okay, and thought to be involved in sperm cell regulation and development. Okay. Okay, now let us discuss about disorders that takes place in gonads. Okay, hypogonadism. Okay, the term hypogonadism designates a deficiency of in ovary or testicular function. Hypogonadism అనేది ఎందులో చూస్తామంటే డెఫిషియన్ ఎక్కడ జరుగుతుందంటే ఓవరీస్ లో టెస్టిక్యులర్ ఫంక్షన్స్ లో. ఇది ఏం చేస్తుందంటే there are several possible origins including the absence of sexual development in an individual or feminine or masculine sterility. Okay, feminine and masculine sterility. Okay, here feminine means um, it's having qualities or an appearance traditionally associated with women. Okay, that means it is a set of attributes, behavior and roles generally associated with women and girls. Although femininity is socially constructed, research indicates that some behaviors considered feminine are biologically influenced. Okay, considered feminine or biologically influenced, whereas masculine sterility means male infertility. Okay, this masculine sterility means male infertility. Mm, what happens means eh, what we say, it does not produce it means sperm production may is very low. Okay, male infertility is due to low sperm production. Okay, abnormal sperm functions, blockages, and that which prevents the delivery of sperm. That means it does not cause it may cause pregnancy in a fertile female. Okay, that means it is inability to cause. Okay, it may not cause. Okay, this disorder can result from a congenital anomaly, means Turner syndrome, or from consuming vegetables that were grown in soil that is rich in cadmium. Okay, this disorder can result from a congenital anomaly, means Turner syndrome, or from consuming vegetables that are grown in soil that is rich in cadmium. In women, hypogonadism manifests in three forms: primary hypogonadism, central hypogonadism, and menopause. Primary hypogonadism is characterized by very poor ovary function. Okay, in fact, primary hypogonadism అనేది ఎందుకు వస్తుందంటే పూర్ ఓవరీ ఫంక్షన్ వల్ల. ఓకే, ఓవరీ ఫంక్షన్ అనేది చాలా పూర్గా ఉంటుంది. ఇన్ ఫ్యాక్ట్, follicle stimulating hormone and luteinizing hormone production, that means hormones produced by hypothalamus and the pituitary gland, is normal. However, the ovaries produce little or no estrogen, also called secondary hypogonadism. Okay, ovaries produce little or no estrogen, దాన్ని secondary hypogonadism అంటాం. Central gonadism వచ్చేసరికి anomaly of results from an anomaly of the hypothalamo-hypophyseal axis, provoking a decrease or a total stop of production of FSH and luteinizing hormone. Menopause is also a particular form of hypogonadism. Menopause is also a particular form of hypogonadism. Okay, now let us discuss about. Okay, now let us discuss about this. In men, hypogonadism is presented by a deficiency in testicular function. Okay, in men, hypogonadism is presented by a deficiency of testicular function. Okay, testicular function అనేది సరిగ్గా లేనప్పుడు దాన్ని hypogonadism అని అంటారు in men. So this concerns sperm production and testosterone secretion. Okay, this pathology is evoked in pubescent males around the age of 14 years. Okay, this pathology is mainly seen in pubescent males around the age 14 years. Delayed puberty is observed with little to no hair growth, increased breast volume, and small sized testes. Delayed puberty is observed with little to no hair growth. ఓకే, ఈ puberty అనేది లేట్ puberty అనేది ఎవరిలో ఎక్కువ చూస్తామంటే చిన్నగా ఉన్న వాళ్ళు, హెయిర్ గ్రోత్ లేని వాళ్ళు, బ్రెస్ట్ వాల్యూమ్ ఇంక్రీజ్ అయిన వాళ్ళు, అండ్ టెస్టిస్ స్మాల్ సైజ్ లో ఉన్న వాళ్ళలోనూ ఎక్కువ చూస్తాం అనమాట. ఇన్ అడల్ట్ మెన్ దిస్ డిజార్డర్ కెన్ కాజ్ లాస్ ఆఫ్ లిబిడో, impotence, hair loss in link with shaving frequency, infertility, etc. Okay, the diverse solutions can be considered to treat hypogonadism, such as prescription of estrogen and or testosterone, surgery, and radiotherapy. Okay, next discuss about hypergonadism. It is a disorder characterized by an abnormal elevation of reproductive hormones, estrogen and testosterone. Okay, it is a disorder which is characterized by an abnormal elevation of reproductive hormones. The onset of this pathology can be evoked by several causes. Okay, this pathology can be evoked by several causes, mainly seen in genetic factors, autoimmune disorders, tumors, etc. In general, hypergonadism symptoms include precocious puberty, increased hair growth, or increase in libido. Okay, symptoms of hypergonadism are about the same in men and women. When a hormonal imbalance is observed during childhood, puberty is brought on precociously. Okay, hormonal imbalance చూసినప్పుడు childhood లో puberty brought on precociously. Frequently increased hair growth is observed on the face. Okay, hair growth అనేది ఎక్కువ ఫేస్ లో చూస్తాం అన్నమాట. అది వెన్ అంటే హార్మోనల్ ఇంబ్యాలెన్స్ జరిగినప్పుడు. ఇన్ ద ప్యూబిక్ ఏరియా అండ్ ఆన్ వేరియస్ ఏరియాస్ ఆఫ్ ద బాడీ. ఓకే, increased hair growth is observed on the face, in the pubic area, and on various areas of the body. The individual suffering from hypergonadism can also have an increase in muscular mass. Okay, సఫరింగ్ ఎవరైతే హైపర్గోనాడిజం తో సఫర్ అవుతున్నారో వాళ్ళకి మసిల్ మాస్ కూడా ఇంక్రీజ్ అవుతుంది. ఎస్ని పెయిన్ రావటం, ఎస్ని మీన్స్ స్మాల్ స్మాల్ ఫేస్ మీద చిన్న చిన్నగా వాట్స్ అనమాట. వాట్స్ అంటే వాట్స్ కాదు, పుక్కుల్లాగా రావటం అనమాట, పెయిన్ రావటం and mood swings. Okay, hormonal replacement therapy is the principal treatment for hypergonadism. Medical observation is necessary in order to find the best adapted hormone doses for the patient. Okay, medical observation అనేది అక్కర్లేదు, in order to find best adapted hormone doses for the patient. Okay, treatment medicines ద్వారా సరిపోతుంది. Okay, this is the overview of gonads. Okay, thank you.